10.
Mm-hmm.
The right eye was 10. And
Mm-hmm.
the doctors were so amazed. What he said, you know what, Mark? You've been here for years. Right about now, there's nothing we can do for you. You managed this thing for a very long time. And my next appointment will be within the next 3 months. But what I'm saying is everything that I'm doing is stable. That means the
Mm.
doctor can't make no money off me.
Well,
Okay,
well,
all right.
Cannot
You
make
come
well.
to
no
that.
money. They can't make no money off of me.
Mm,
And
All
that's a
right.
true blessing.
Yes.
And also, I did a serious walk and I'm about to post it.
Mm.
It blew
Okay.
my mind. I had
Mm.
my caregiver take me, and he was like, Mark, oh my God, you are getting this thing in. I said, yes, I am. And I thank
Mm.
God for that.
Mm.
And I'm over this COVID. I thank God for that. That was, oh God, that was one of the worst setbacks that I have dealt with. But
Mm-hmm.
God took control when I didn't have control in my life. And I am
Mm.
so ever grateful. And then when I
mhm,
called you, Dr. Paul, you just opened up the doors, bro.
All
mhm,
right,
You
man.
say, no, thanks,
mhm.
dude.
Man, Mark, I thank you, brother. Also, that God is good, bro.
Yeah, no
Because
doubt.
when you
Yes,
came
he
into
did.
the male chorus rehearsal that day, you just cried out. He the big and call. You came to church and said, "Hey, I remember you just yelled out, help!" You just said,
Mhm.
help. In the middle of the class, nobody knew who you were. That was your first day at Enoch, right? Wasn't that
Mhm.
like the first day you came
Mhm.
there?
Mhm.
Yep,
And he
yep.
just came in. He said, God told me to come here for help. And I just happened to be there that day. Remember? Because I hadn't
hmm
been to rehearsal in a long time. I just happened to be there that day. And I'm looking around like, this is too prophetic.
Mhm.
And then I
Yes,
knew right
it
then I had
is.
to help you, brother. And but that's God, man. That's not me. That's
Yes, it
God.
is.
I think
Yes,
God set
it
that
is.
divine appointment up for you, that you would be there and I would be there at the same time. And we met each other.
Yes.
And then from the rest, the story, the thing that made me, and I always had this thing, I call it righteous indignation.
I know that's right.
Righteous indignation.
Yes, sir,
When you
buddy.
told me the story, you said that they told you that you're probably not going to be able to walk anymore, and that in about another couple months, you're going to be in a wheelchair for the rest of your life.
Mhm.
That's when I felt righteous indignation for you. And I said, no, 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 brother, we're going to get you together and you're going to prove them all wrong.
Yes,
And I
sir.
say, every time you go to the doctor's appointment, if y'all don't know Mark throws down his crutches, whatever, and he walks into the same spot every day, every time he has to take an appointment. So, Mark, I can only say, family, let's all give Mark a big old hug. Come off
As
of mute,
always, yes, indeed.
everybody.
That's
You know
exactly
how we
right.
do it on the family tree.
Yeah, yeah,
Give
yeah.
Mark a
Yay.
shout out.
That's right. That's right,
God
baby.
bless you, Mark.
Congratulations.
Yay!
Awesome
Awesome.
job.
Congratulations,
God
Mark.
bless you. Bless
Giving
you.
Mark.
Awesome.
Yay!
Nice. Good job.
Congratulations.
Good job. Thank you.
Congratulations, Mark.
Congratulations.
Yay. Yes, Mark.
Congratulations.
Mark.
Congratulations,
Congratulations
Mark.
with you, Mark.
Keep
I
your,
appreciate
we're going to keep you
You're the
encouraged,
man. You're
brother.
the man, Mark.
Check it out.
Congratulations.
Yes,
And
Say
indeed.
one
and
more
with
thing.
all that,
Congratulations.
yes. And with that, with everyone that we talk about today, we want to keep everybody in our prayers. Amen. So
Yes.
we want to continuously keep everyone up to date on what's happening with it. Keep it in your hearts, to your minds, but also understand, hopefully someone can listen to Mark's story and be encouraged by that. So
Yes.
thank you,
Yes.
Mark. I appreciate you, buddy.
All right,
Does
my
he
Can I
have
say one more
MS?
thing?
Did he have
Can I say,
MS?
Yes.
yeah,
Mm-hmm.
He
can
Yeah.
I
have
say one more
MS?
thing?
Yeah.
Am I
Yeah.
still alive?
Yeah. You
Yeah,
still
you're still
alive.
on. You're still
Okay,
alive.
check this out. When I first started out, Dr. Paul said, spirit, mind, and body, crawl, walk, and run.
Yeah.
You know how many times I felt, oh my God, I felt so many times, but I kept getting myself back up
Numerous
and
times.
asking God to give me strength. And each time he built my body back up again. So
Yes.
if this is the first person that's going through this, if you fall, get yourself
Just get
back
up.
up again.
Yes, sir.
And if you fall again, you keep getting yourself up because God is with you. Believe me,
Yes.
it's just
Yes.
you. So
That's
you
right.
get yourself up, you get together, and you believe me, I've been there. I've been there and done that.
Yes. Yes. All right. Thank you, Mark. And
Mark.
Mark, I can't tell you enough, man, how much we're proud of you and everything that you're doing. And
Yeah.
and you're applying the principle. I send folks to Mark now. People, when I need people to be encouraged, I use you an example, Mark, and I say, you need to talk to Mark. Because Mark got that energy and he can help you along your journey. I also want to mention before I go to the next person, I want to say that we are streaming on YouTube right now. You can see maybe up, I don't know if it's actually in your side, but we are streaming on YouTube.
Yes,
Make
I'm
sure you
looking at
mute. If you're not talking, please mute your phone. All right. We are streaming on YouTube. That's under Dr. Paul. And that's the let's see, which one are we under, Big B? I forgot which one we on.
The health holistic health class.
There you go.
Yeah.
Yes, Dr. Paul. Just punch in Dr. Paul on the YouTube,
Right.
and it'll pop right up. All right.
Yes, sir. I'm looking at it
And
right
we
here.
are
Just a
streaming. And if someone can't get in, tell them go to YouTube.
I know that's right.
You might want to send out something to someone if they're trying to tune in. All right. Everybody's still piling in here, though. I got them still chiming in, Big B.
Yes.
And
yes.
and Big B, if you want to take some questions off of there, also you can take a look. See, okay.
Sure.
All right. Anyone else that has a testimony, the floor is open for anyone that has anything. If not, we're going to go to our questions and answers. And if anyone have any thing that they want to share. All right.
I have a testimony.
All right.
Okay.
Summer, go right ahead.
Summer.
Yes. Hi, Bill and Dr. Paul.
All right.
So of course I came in, I had the scan done. And you told me about what was going on with my spine. So I went to Dr. Lenny and he did a full scan on me. And of course my spine was jacked up. I mean, it was pretty jacked up. It was so bad that I couldn't even sleep in my bed. My left hip would wake me up. I could only get maybe an hour and a half to 2 hours of sleep. I would have to get up and sit in the reclining chair. And then I would get numbness and tingling down my right leg. It was just bad. I could not sleep in my bed. And it's been months. And so I have to give Dr. Lenny and his crew, Dave and Claire, a shout out.
Yes.
They are
Dr.
slowly
Lenny,
getting
Dave and Claire.
They're getting my body back into, where I'm able to move. I've been sleeping in my bed now for about a month.
Girl.
All right, let's give her a shout, y'all. Off of Butte right now. Right there. Stop right there.
Awesome.
We gotta get you the thumbs up and the shout out. Congratulations.
Awesome.
Awesome. Congratulations.
Keep it up.
Job well done.
Yes.
Awesome.
Well done.
Awesome, Summer. So it must feel good to be in your bed again, huh?
Yes, it does.
Congratulations.
You probably got some new sheets and everything. New pillowcases.
New comforter, everything.
New comforter.
Well, I can't take it.
I'm going to enjoy this now. That's right.
Oh man, that's what's
Yes,
up. I love
yes.
that.
Some Summer.
Love to
Thank
hear
you
that.
so much for that. And again, Summer, just like Mark, you're applying the principle. I believe everyone on here has a reason why you tuned in this evening because you're concerned about your health.
Yeah.
There's a lot of people around that are not concerned about their health. They look and say, I don't want to know. You do want to know. You want to find out something, so that you can make the change. Even if it comes up that we see things out of balance, nothing is ever to the degree where you can't correct it.
Yes.
Got it? So knowing is all the battle. That's half your battle right there is knowing. Now I put a game plan. We put you on the game plan, but you got to follow it. Got it? All right. So thank you, Summer. Appreciate you.
Yes, indeed.
Thank you.
Indeed.
That was a stealth mama there, baby.
Another one.
That one
She
came in stealth.
in.
She came in, snuck in.
That's
Excellent.
great. That's
Excellent.
great.
All right. Anyone else before we start off with the questions? Anyone else have anything on their heart, on their mind? Anything? Mark, I'm going to pull you out of there.
This is Neetha.
Hey, Neetha.
How are you?
Grand Rising, everyone.
All right.
I just want to say, this family tree is growing because I'm meeting people at Dr. Lenny's.
Oh, yeah.
I met
Yeah.
Summer. I met a couple of people, and they see me. I know who you are. They said, I said, "Please."
Yes,
You
I
star,
did.
Neva.
Yes,
Hey,
I
that's
did.
Neva.
I sure did.
You know,
Yeah,
you-
and I was coming
Nitha.
out. I was coming out of his office, and the car was coming in, and they said, "Nathan," and I'm looking, and I said, "I don't know who that is," and I'm looking. I said, "Do I know you?" She said, "No, but I know you."
Okay. Okay.
Yeah,
That's
there
See?
you go.
Family tree. And I have
Yes.
to admit, I was in bad shape too with Dr. Lenny.
Mm.
And I'm telling you, because I was walking, bent over, and I had to watch my posture, but
Mm-hmm. Sit
telling
up
you,
straight.
it is
Mm-hmm.
getting better. It is getting better. And
Yes.
I've
yes.
never had an evaluation from a chiropractor the way that Dr. Lenny does.
Yes, indeed. Very
Excellent.
thorough. Very
Excellent.
thorough, guys.
Excellent.
The whole
Awesome.
staff is great. I'm
Yes.
telling you.
Yes.
Yes, yes. Shout out to Dr. Lenny,
Yes,
and his
indeed.
whole entire staff. Everybody's doing great. I love the fact that, what the encompasses that myofascial release, which is that, muscles, you got to loosen up those muscles. And that means, muscle, that a lot of people have knots in their back, and
Yeah.
those muscles
Hallelujah.
tighten up. A lot of that's dehydration, y'all, dehydration a lot. So we got to make sure we're staying hydrated. I had a conversation with Dr. Lenny one time. I said, dehydration is a lot of problem. He says, you telling me people will be getting adjusted and lock up, with some kind of a
Yeah. How about
hold
that,
up right
man?
there. Got a cramp. Oh.
How about that?
know,
How about that?
And that happens. So water, water, water. All right. All right. Thank you, Nitha. Appreciate you. All right. Who else we got here? Big B, you want to start off? Anybody
man,
else?
we got,
Anyone else? If not, we're
there's-
going to start off with first caller,
Yeah,
or
there's a
we're going
question
to.
here, Dr. Paul. I want to know, what do you do? What do you recommend for hypothyroidism?
Hyper or hypo?
Hypo.
Too slow.
Hypothyroidism.
Right. It doesn't matter whether too fast or too slow. You're still dealing with thyroid as weight, temperature, and pressure issues. So that is usually a deficiency, mineral deficiency. And usually we start with sea vegetables. We've talked about that several times. So sea vegetables, we start off with the kelp. You can get liquid iodines, things like that, not to diagnose, treat, cure, prevent any disease, just food for the soul. But those are the things that we start with right there. We start there and then we move forward. But I also say test yourself. You can do the basal test where you actually test yourself with your temperature. You can take a thermometer, sit it by your bedside, get a pen and pad, and every morning you wake up without getting out the bed, take your temperature.
Yeah.
Got to take your temperature, write it down, do it for 7 straight days. After 7th day, right, add them all up and divide it by 7. Somewhere around, you want to make sure that you're close to 98.6. If you're falling low, like a 94, 92, yeah, we got thyroid issue, imbalance. So hypo, too slow, hyper, too fast. Still moving too slow or too fast. We got to get you back moving again. So we got to balance that out. I would start off with a detox. We start to do a detox also of the lymphatic system. That also helps with the process of the thyroid. There are some other herbs that we do, but we would start off with an assessment to see where you are, and then we will move you forward. Okay. But sea vegetables, if we start off, sea vegetables would be good. All right.
All right. Sounds like a winner. All right, Dr. P, one question here. Can you make the green drink at night and put it in the fridge for the next day?
Yeah, it shouldn't be too bad, but I mean, there's nothing. The green drink is too easy to make, y'all. Come on now. All you doing is stirring it up like Kool-Aid. That's all you're doing. You're just taking 3 scoops and putting it in some juice. That's it.
But Dr.
You
Paul,
know,
what if I'm
if
just
you can,
laissez?
yeah. What'd
if
you
I'm
say?
Just laissez at the moment.
Let's.
Laissez.
Well, I'm gonna say this. Yes, it will still be there, and if you may want to, make sure you shake it well. That if you're using it, make sure you stir it again. Make sure, but I would suggest you just do it right on the spot.
Yeah.
Get the freshness the way it's supposed to be. Got it? Don't let it sit too long. Let it sit overnight. You don't have to have it sit overnight. Got it?
Right.
Yeah.
Mhm.
Okay.
Okay. Diane put a question in there, but I'm not quite sure. Diane, can you come alive and tell me what this is, your recommendation product that's called Juice Plus. Dr. Hall, what do you know about Juice Plus?
Yeah, I know Juice
Okay.
Plus.
Okay.
Yeah, Juice Plus is a good company. They have a brand of products that several people part of the I know a lot of people that are selling Juice Plus. I only just have a few concerns with Juice Plus, and that was that they were having probiotics in there. And some of them, they were mixing fruits and vegetables. That's all. Good company, though. Good company. But, you know, I'm a very stickler when it comes to what people really need. And I think that they just break the rules sometimes. But this is with all of them. All of them do this. So it's not just Juice Plus. It's all of them. They'll put a little probiotic in there. But remember, who's the greatest converter? We are the converters, right?
No
We're
doubt,
the
no doubt.
converters. So we need the prebiotic, which is the vegetables, the fruits, nuts, and berry seeds. We convert it, we flip it. And then if you start to take that out of you, then you're creating a deficit with your body that your body doesn't know how to now break down or convert properly. So that means your gut flora is not in proper balance. So remember, you are the converter. We are the converter. No one, nothing convert already for you.
Right.
So Juice Plus is a good. There was one that I did say that was cool, and I believe it's one that they have without the probiotics. I think it's one without the probiotics. You know, but you got to watch the probiotics, because if you get hooked on probiotics, they're going to keep you coming. You know, because you're always going to have that issue. You got to let your body and train your body to do the proper way of doing it. All right. Okay.
Do you know which one is without the probiotics?
No, I just remember I reviewed that a while back. I've done that. I reviewed that one years ago, and then I just did it again for someone else because they were asking me about it, because I think it's a program that they were sharing. They were actually selling it themselves. So just make sure you look at the breakdown. There was one that they had a berry plus, I think it was one, and it was a vegetable and fruit combination, which we know you don't do. You don't mix fruits and vegetables, right? I believe it was the berry. I believe it was the fruit one that was okay. I think it was the fruit one because it did not have any probiotics, because usually with fruit, that's one of the highest forms of prebiotics you want. That it already has, you know, what you need. You don't need any help with that. You got it? If it's fresh.
Yep.
If it's fresh. You got it? You got it.
Yeah.
Nope.
So
If-
question on that. The fruits and vegetables that they say that they're putting in there, are they organic fruits and vegetables?
Yeah, you got to tell me that. That's what I'm saying. You got to tell me that. That's what I would be asking.
All right.
That's what you got to
Okay.
ask them. You got to ask them what the process was. You know, when I
Okay.
do my greens and things, we're grabbing it from the raw source. You know, we get it from right down by the equator. We getting the real deal. We're not playing around with this thing. We're just trying to get it without no probiotics, because you don't need probiotics when you have a prebiotic. Got it? You got to remember that. But I understand.
Yep.
I understand what they're doing. I understand. I really do. It's better still than something of someone not doing nothing at all. To be perfected, we got to live in a spirit of righteousness and perfection as much as we can. And that's what I like to do. I want to be very, very much on point. All right.
All right, Dr.
Thank you.
Paul, if I remember correctly, Linda Santa.
I'm having a problem hearing Bill. I don't know if anybody else is.
Okay, can you?
Bill,
can you guys
yeah,
hear
that's
me
all I
now?
was saying. You
Yeah,
a
we're
little
all
far
having
back there, buddy.
hearing him.
All right, hold on one second. Maybe.
No, now you're okay now. I think
I
it was
am?
just a little too
I
far
hear him
from
just
you.
fine.
Okay.
Now you
all right,
now
all
you
right.
now you just went up again. I think when you
Oh.
leaned up a little bit, I think it's the
Probably.
angle of the mic.
Yeah, probably so. There was a question in regard to there was a product called collagen building protein peptides. I'm not quite sure. Can you see that, Dr. Vaughn?
Yeah, I remember we talked about that. Remember we
Right.
talked about that last week.
Right. Okay.
Yep.
Wh-
What was
are
the
your-
question
What
though?
are your recommendations about this? Is there something that
Yeah, I remember I told them I don't recommend any bovine or any peptides unless it's actually if it's protein based from vegetable sources. Is that what they're saying?
Linda, are you there?
I am.
Okay. Can you kind of tell us what this is all about?
Okay. I'm sorry. I wasn't quite ready for that
I
question.
know that's all right. We always thought, and we're coming through stealth, Linda, just like you guys.
Right. Just snuck that one in. So
Yeah, just as long as it's not animal. I just don't recommend any animal proteins. You know, and that's where a lot of the collagen comes from. So you know which one this one is?
It's not animal based, and
Mhm.
it is organic pea protein. I'm going off memory. I
Mhm.
think maybe brown rice. I think there is sea buckthorn high up on the ingredient list.
Mhm.
Um,
I think we said
and
yes to that. I
mushroom.
remember looking at that. Remember we looked at that last week. We
Okay,
said yes. Yeah, I gave that a yes because I do remember it now. Yeah, when we said
because
that
I
as
know
long
someone
as
who said they had instant relief in their knee pain.
right. But
Uh-huh.
remember we're going back on the science. Remember the science is if you're going with something that's plant-based or protein-based, plant-based
Uh-huh.
protein, that's the difference. That's okay. That's fine. Remember that's something that your body recognizes. Then you break it
Right,
down.
right.
And then because we went into the sea buckthorn, remember I remember
Yes,
that.
yes,
I remember
yes,
looking
yes.
at that.
Okay. And it has
Mhm.
kale and spirulina and tremella mushrooms and
Mhm.
marine algae.
Yeah, right, right,
Yep,
right.
yep. All
Mhm.
So
good. All
perhaps the
good.
sea buckthorn is what's causing the joints to feel better. I was just curious.
No, it'll be all of it. All
All
of
of
it.
it.
Yeah,
Okay,
All
great.
of
everything
it.
is there.
All of it. Across the board, everything that's on there. Because anything you have plant-based protein, collagen, that's building blocks. Those are all good. And then you got the
Right.
omega. Remember, anytime you got the omega-3, the sea buckthorn, you got the omega-3, 6, 7, and 9. So that's across the board. That's everything you need. That's plant-based omegas. Mhm.
Okay. Sounds great.
Yeah. All good.
All right. Now, can you hear me better now, Dr. Paul?
Oh, now you're extra loud now.
See, man, it's always got to mess with a brother of color, man. What I tell
Should
you.
I get my other question out of the way?
Absolutely, we can hear you now.
Yeah. Okay. Good.
Yeah.
Can I get my other question out of the way and let my hand down?
Sure. Go ahead.
I know someone who is like approximately 85 years old. They had a fall, had to have hip surgery, but they've gotten weaker in their lower parts. What do you recommend or suggest for them getting strength? They said they want to walk again, which is part of the battle. In their mind, they want to get up and walk again, but they're having balance issues. Any suggestions?
Yeah. Number one, you got to put them on. You got to put on. Is it he or she? I just want to be correct.
He. I'm sorry, she.
That's a she.
Okay.
She, uh-huh.
Okay, so she wants to definitely make sure, and she's 85, you said 80, 85?
Approximately. Yeah.
Okay.
Okay.
All right. So some of the things when you look at seniors at the 80, 85, you got to make sure they're hydrated. That's the biggest problem. Bone density becomes very brittle because of dehydration. And the reason is they don't want to drink water because they got to go to the bathroom. Got it? So we got to make sure the hydration is high and also keeping them clear from urinary tract infections. Seniors suffer from a lot of urinary tract infections because they're holding the urine. Or if they've held it for so many years, now it weakens the bladder. So that can be a problem. That's a double problem. So hydration, we got to look at that first. Number two, bone density. I mentioned for seniors, I have a couple of things. Not to diagnose, treat, cure, prevent any disease, just food for the soul. One would be teas. I sort of helped them with teas first. So teas would be like bone set. Okay, bone set. That's BONSET.
SCT.
Give them a good tea like bone set or comfrey.
Right.
Comfrey. COMFREY. Another one would be Buchu. These are bone density, but also liver cleanses. Helps increase the level of bone marrow. Next one would be coral calcium.
Right.
Okay, coral calcium.
How do you spell Bunchu?
Buchu, BUCHU. And then remember, these are I'm just giving out the list. It doesn't have to be all of them. Just one of them. Just one is all you need. Got it?
Right.
What about the weakness that they're feeling as far as?
Yep, that's what these are. These are all for regenerating bone density. So that's what they're experiencing. This brings back it's cleaning the liver at the same time as it's increasing bone density. That's the key.
Okay.
See, whenever you feel any weakness of any kind with liver or you're just tired all the time, that's your liver. So that usually is felt in, your hands and then sometimes your eyes. Those are the two places that you feel the weakness first. So usually we start with those. We'll see what we said. Bone set. We said coral calcium. We said what else?
Comfrey, Buchu.
Comfrey, Buchu. If I were to give you one more, it'd be alfalfa. Okay, alfalfa. These are very strong because these are herbs that grow deep in the earth. So you can, a good tea for a senior would be, bless you, a good tea would be something like the buchu. That would be a good tea, or something like a comfrey. Those are good. All right.
What about physical therapy? Any type of physical therapy to like strengthen the muscles, or?
Well, you always got to do that. That goes with it. Always flexibility, exercise, stretching. If they can't get up and move around, just have them in a chair. Have a chair exercise for them. But try to do it same time every day. We say same time every day. Is you're trying to get into a routine, a circadian rhythm. So 8 o'clock, 9 o'clock, 10 o'clock, whatever the time, try to stay on top with that. All right.
Do you think their gallbladder could have caused them to have issues being removed?
Oh, yeah. Well, that's all digestion. You're not able to assimilate. That could have a lot. But to be sure, have her come on in. We'll do an assessment. We can tell you exactly what's going on.
Thank you very much.
All right.
Can they take those teas with their medicine if they're on blood pressure medicine and gabapentin and stuff?
Well, if they're on medication, that's why we recommend an assessment. Always remember, everything we're talking about is food. So it's not going to be a problem. We just don't take it at the same time as you would take medication. Usually it's 2 to 3 hours before or after medication that you would take it. So your body uses the same through. Remember, medication is suppressive therapy. It's suppressing the symptoms. That's what it does. That's allopathic concepts, which means suppress the symptoms. But we say we're feeding the body. So they use the same throughways to get into the system. So don't do it at the same time. Always 2 to 3 hours before or 2 to 3 hours afterwards. All right. Good stuff.
Okay. All right.
What we have here?
All right.
Big
Man, before we get to Kamara, there's one question here that says, which is better? What is better to use? Reduced glutathione or liposomal glutathione? And how much?
Okay. What was that again?
Okay. What is better to use? Reduced glutathione or liposomal glutathione?
Either one.
Either one. And how much?
Yeah, well, take it as recommended. That's all you want to do. Just always take it in. See, they're going to start to take when they know that people are doing a certain specific herb or nutrient. Right. They're going to try to make more money, of course. And I mean, this is just this is the capitalist spirit going to split it into say this is a little better or add something to it.
Sure,
it's all good. Remember, you have natural glutathione. Glutathione is something that your liver makes. Got it? But the only problem is if you have high testosterone levels, you don't make a lot of glutathione. It's the number one antioxidant of the body. Got it? So what you're trying to do is raise that. You raise it by its highest natural form by eating anything out of the ocean. That's sea vegetables, and that will raise your glutathione.
Yes.
So that's the things like the chlorella, the kelp, the bladderwrack, the nori. These are all sea vegetables. Got it?
Right.
Spirulina.
Spirulina. Thank you. Yeah. So you just have to make sure you raise your glutathione by taking the sea vegetables. Bacopa. Y'all forgot about Bacopa, didn't y'all?
No.
I didn't forget about it.
I know that's right.
People don't realize that Bacopa is an aquatic, so it's land and sea.
Yeah, buddy.
That's your mind. You want to get your mind right? Somebody get on your last nerve. Get your mind right, big.
Well.
Get your mind right.
Dr. Paul.
Yes.
Dr. Paul.
You know what it is.
Man Wonder. Just listening in.
Hey, man, what's going on, buddy?
Man, not too much.
All right, straight from Connecticut.
Man, I'm feeling a lot better too since I started doing what you told me to do.
See that? Again, it's all about doing what you told to do. So
T Wonder. I don't know if you want to share. It's up to you, buddy. It's up to you.
Of course.
Okay.
I'll give them a brief a little brief testimony. Well, anyway, for a while now, I have been experiencing a lot of chest discomfort, a lot of, I'm not going to say pain, but I'm going to say discomfort.
Okay.
And I spoke to Dr. Paul, and Dr. Paul told me to start boiling those red onions.
Well.
And also take twice a day the PPQ, I think it is, and the CoQ10. And the Dr. Paul Green drink along with, now I do my burdock root, which works on the liver at night when I get ready to lie down so my body could just kind of relax. And I don't know if that's good or bad, Dr. Paul, but that's what I do. Okay. But anyway, as a result of doing these things and taking this red onion juice, boiling this red onion for 20 minutes and drinking it, immediately I begin to feel better. I don't really feel that chest pain any. I mean, it's a little sometimes, but not like I was feeling it at first quite frequently. So yeah. So I just wanted to share that with you all. Just kind of give you a little brief testimony.
Man,
Dr. Paul is on the money.
That's what's up, T man. Yeah, buddy.
T Wonder hand.
Yes,
Everybody
sir.
come
Yes,
on
sir.
mute.
Yeah. That's what's up.
Yes,
Go T, big T, man.
Congratulations.
Good work.
Do it, Big T.
Yes, indeed.
T1, yes, excellent.
Yeah, man.
That's what, hey,
And
Dr.
T Wonder, T Wonder in stealth, man. He coming in stealth, Big T. He
Yeah,
coming
I
in
seen
stealth in
it.
with
He
the
snuck in.
testimony.
Hooked
He
us
just dropped
around,
the bomb on it.
hooked us around the foot.
Yeah. And T Wonder is a musician, y'all. He played with Stevie Wonder, right?
That's all right.
He played with Stevie Wonder.
Yeah.
Yeah,
Oh,
he
yeah.
played with Stevie Wonder. We got a star in the house.
See, listen, we get this tree gets blessed with a lot of folk, man.
Yes,
you just gotta hang tough.
Yeah.
Yes, indeed.
Well, T Wonder, you
Yeah,
stay on
appreciate
path,
you, man.
man. You know, as I was
Yes,
saying
yes.
there, you know, when I was talking about blood pressure, when you start to
Mhm.
you know, those areas are what we see all the time. It's really a matter of about 2 or 3 things, about 3 different areas that you got to watch out when it comes to blood pressure.
Mhm.
And that one was, remember, it's the endothelial, which is the vessels in the lining of the arteries and veins. When they can't
Right.
stop pushing and moving,
Uh-huh.
that's when it's going to have congestive heart issues. It can't get back to the heart. That's when you start feeling that little uncomfortableness in the chest. Got it? And the other one is the plaque buildup. The plaque buildup in the arteries and veins comes from a lot of the oils. Watch the oils. Third one is dealing with misalignments in the back. So usually when we hit all 3 of those, and then we start to, get that red onion moving, y'all. That's what the alliums do. They break up the plaque in the arteries and they black up all that stuff. That's what they do. They're the agitators. And then the anthocyanins is actually the purple. So if you get a purple one, it's even better.
See.
That's the
Man.
antioxidant. So if the purple is even better. So you got a double going on there. So thank you, T1. Appreciate you, buddy.
Yeah, man. That's
All
what's
right.
up.
The red onion tea
Appreciate you,
can
Dr.
count as
Paul.
your water.
What'd you say, Linda?
Can the red onion count as your water for the day?
No.
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 Oh,
no.
shucks.
See, you better stop trying to shortcut, Linda. Stop that.
It's like, oh, shucks.
Yeah, shucks. Get your work here, Linda. We got your back. We got your back.
Yeah.
Oh, yeah. That's
All right, Dr.
Okay. Thank you, buddy. Appreciate
Yeah, man.
you. All right. Who
All
we
right.
got up there? Is that
You're welcome,
Kamara?
man.
Yes, come on up in the corner, Dr. P.
We got Kamara
I
up
hope you
there.
can hear.
Yeah, we
I
got
have
you.
I have 2 things going because I'm working.
Yeah, I know. I saw you.
All right, so it's not echoing.
No, it's not.
Oh, good.
No,
All
not
right,
now.
I'm
It
gonna
was
start
a little bit ago, but it's kind of gone away now.
Okay, great.
Mhm.
So, Dr. Paul, I wanted to ask you a question. I was listening to, as I often do, a gentleman on YouTube, and he was talking about a theory that he practices where he doesn't believe you should drink water, but you should drink the fruits and the vegetables, the water that those items produce, because
Mhm.
you're not getting the same volume of nutrients if you were just
Mhm.
drinking water. Now, I'm not prescribing to that, but I just wondered what you thought about that.
Sure.
theory.
I mean, that's
He called it H23 or something. He gave it some kind of
yeah.
ranking.
H3O. H3O. That's
H3O.
H3O. That's the
H3O.
hydrogen with the minerals. Got it? So it's not saying it's bad. But my only question is there what kind of fruit are you eating?
I know that's
You
right.
know, in the conventional, you got to be addressing when you put that information out, you got to help people break down the current times that we're living in. Got it? Now, yes, that would be normal. Just like when you say eat for your blood type and all those other things, they're all good. But you got to watch out for, you got to say, are these conventional fruits and vegetables or are they organics? Because if you're not, they're spraying stuff right now.
Yes, Lord.
The one that I have to address with fruits and vegetables is called chlorpyrifos. Chlorpyrifos. And chlorpyrifos, all you got to do is just Google, side effects of chlorpyrifos. Got it? Chlorpyrifos. And that's what my concern is. You know, when you start to deal with fruits and vegetables and you're trying to get something from something that's already been modified and it doesn't have seeds no more. Yeah, the water, you'll have it in there, but guess what? That water is going to be modified. Got it? So chlorpyrifos is spelled CHLORP as in Paul, YRIFOS. So my concern is that if you're telling people to drink the water, the H3O, you also have to tell them about the conventional versus organic.
Yes.
And even if you have organic, you still got to wash them with baking soda, aluminum free.
Right.
You got it? Because you still have an agent on there that's messing up the actual fruit itself. And also remember, we got an issue with soil also. We got a soil issue. So, I mean, it's a lot to take in, y'all. But these are the reality when you start to look at when they started tracking down this thing called chlorpyrifos. They spray it mostly in places like Puerto Rico. Got it? Now, one of the documentaries you're going to see is when this company, which is Monsanto, actually started to do this spraying. They did it in Puerto Rico because they have much acres and acres of land where they're growing these beets and things like that that they're putting out there. Well, they're spraying them with this chlorpyrifos, and those that are neighboring the area around where the farms are literally having lung problems. So that means people that were living like next to these farmlands having things like pneumothorax where their lungs were just collapsing. Children just coming out and they just all of a sudden their lungs collapsing. Wow. And they were trying to tell them that, it wasn't because of this stuff. It wasn't because of stuff, but none of this stuff started happening till y'all start getting there.
How about that?
You got it? And that's where I'm saying, so that's why H3O is good if we were all living in that utopia's world. You know, in that utopia world, if we were living where they weren't spraying, yes. But right now times are changing. You got to stay up on top of your game. Got it? All right, family.
I just wanted your opinion on that phenomenon.
All right, good stuff though, Kamar. Good stuff. Good stuff.
Thank you, Dr. Paul. Thank you.
Kamar, the old adage, love us, don't trust us. Ooh, did I say that?
Love us, don't trust us.
Hallelujah.
That sounds like a song, Big B.
Get me
a country song.
Well, get me a ukulele. We'll be fine.
All right.
All right. We have next Tasha Burke. Tasha, you there? Tasha, there you go. She got to be there somewhere because it's been there for a minute. If not that, we'll go to Jackie and come back to Tasha.
I'm here. Sorry.
Okay. All right. That's all right.
Hey, Dr. Paul. I know I was supposed to call last week. I've been so busy. I was telling you the last time my 7-month-old, he has eczema and he tends to itch. Right. And I was wondering what you think I should try to apply on his skin. I know you were saying something about probably something he's allergic to that I am breastfeeding.
Yeah, I remember we talked about that. Right. I remember that now. Where's he breaking out, by the way?
Well, he's itching in the neck area, his back, his head, his legs, his stomach, practically like head to toe.
That's the lymphatic system. That's the lymphatic system. Something he's getting either too much of And something is the body's registered that as I got to get rid of this. You were telling me something you were doing though. What was that you were saying you were doing?
I did remove dairy and out of my diet. So I'm not having no dairy or anything like that. I took out eggs out of my diet as well. The doctor did tell me wait till he's 9 months to do a allergy testing on him because his eczema was like really bad. Like he had a rash. Like so he still have like a rash on his stomach area. And like do have like white patches on both arm, elbow. I noticed is coming down on his legs. So I did start using like shea butter, Avena lotion. I was using, but it's not helping. So the shea butter is helping him. Like I know this is not dry as much as anymore. And I do also use aloe vera, like fresh aloe vera plant that I have in my backyard that I'm growing, and I use it on his skin. And I do also like when I do give him bath, which I know babies that has it, you only can give them like bath 3 times out of 2 or 3 times, because their skin. So I did try baking soda that they was telling me that it would help him with the itching in the water and a little bit of lavender oil.
Yeah.
In the water.
Yeah, you got to, but here's the thing. I would slow down a little bit. You're moving too fast, just a little too fast. Not too many things for the baby. Got it? They don't need a whole lot. You got to try the one thing and see, give it some time and make it work. Don't move too fast. Got it? Don't try too many things because their bodies are they respond very quickly.
Yes.
Their systems are very sensitive. Apparently there's something that, are you taking a blood cleanser at all? Any type of blood cleanser? What herbs are you taking?
I'm actually not taking the herbs.
What are you taking? Anything?
I'm not. No.
Okay. So are you doing anything like, what do you like a lot of? What are you eating? Because it's something possibly that you're eating. What do you like a lot of?
See, I don't really eat like I cook my own food all the time. I don't eat out.
No, I'm not saying out. They're saying, what do you eat a lot of? Just something that
chicken, like chicken. I eat a lot of chicken.
Okay, you got. Okay, stop right there. Stop right there. So when you're doing the chicken, how you preparing the chicken?
I bake it. Like I do a lot of baking.
You bake it. Okay.
Yeah.
So you don't use any oils, right?
I do use like olive oil.
Okay. You're baking your chicken with a little olive oil.
Yeah.
Okay. Now make sure it's not from Italy, right?
Right.
Okay, got it. So anything else that you could be ingesting that like it could be something
I do like eat rice, but I eat brown rice, potatoes, like pasta. I season my food with regular seasoning.
Yeah. Okay, good. No seasonings like Miss Dash or nothing like that stuff. Right?
No.
Okay, got it. So something, just be careful, look around, see what you can find something that's, see, when you're breastfeeding, he's pulling something that's causing him to react to get something out. Something's trying to come out. Was he vaccinated, by the way? Was he vaccinated?
No.
Okay, good. So definitely something is going back to food then. That's something that's definitely trying to come out. Now, neem, we didn't talk about neem. Neem oil. Okay, neem oil. Okay, neem. Okay. Neem is sort of like the we call that the sort of deal with so many other things. It's one of the miracle trees. Okay, so neem oil may be something that can give him the relief. Usually when nothing else works, neem is usually one of the ones we use. So you can get it on a roll-on. You can get the neem roll-on. You can go online and get the roll-on. And you can just roll it on those certain areas around him, especially around that area around his neck and things like that. Because everywhere you mention is part of his lymphatic system. Specifically around his neck, that's the cervical node. Anything under the armpits? Do you notice anything under the armpits?
He do have like rash. So he has a little
Yep,
bump.
yep. This is his lymphatic system. His lymphatic system is invaded. Something is invading his lymphatic system. Now,
and another thing, I do give him the oatmeal cereal and
there you go.
Oh, no.
That's it.
No, no,
That's
no.
it. That's it. That's it. It's the oatmeal.
Mm-hmm.
See the oatmeal. This is a good one, y'all. The oatmeal is being sprayed with the glyphosate.
Yes.
Got it? Remember we said the pre-spraying of that, the glyphosate. Remember the guy that sued Monsanto, whose name was Dwayne Johnson? Not The Rock, y'all. Not The Rock, ladies. Not The Rock. But he actually sued them because he was exposed to the glyphosate, which was the Ranger Pro spray that they do outside on the dandelions and stuff. Well, that's the same spray they're spraying on things like the oatmeal. You got it? So you got to pull off of that, Natasha. You gotta, it's the oatmeal.
Okay.
Usually it's the oatmeal. So you got to move to something like a good farina or brown. They got one called brown rice and farina. That's really
brown
good.
rice. Okay.
And farina. Yeah, it's the oatmeal. Usually that's going to block the gut also. Yeah, and that's going to cause him. He's picking that off. He's picking that off. He's picking that off. Yep. And let me know how that works out.
I sure
Increase the
will.
water. No oatmeal. We say no oatmeal, period. Stay away from oatmeal, everybody. Oatmeal is just blocking the gut. It's doing a lot of stuff. They still have not given us an explanation of why they pre-spray it.
Right.
But other countries around the world do not allow it to come in their country, but the United States does.
And there's a question about, there's a question, Dr. Paul, in regard to what about the red mill oatmeal or traded organic
I've
oatmeal?
already, I've always addressed this. And again, I remember I said Bob's Red Mill still had it, but it was at the lowest amount of glyphosate. Not all of them have it, but his was at the lowest rate of glyphosate. When we say, there is no acceptable rate for poison, got it? Leave it alone. Got it? Stay away from it. Plus, it damages and it can cause lectin issues. You got lectin issues. You can't digest something like that. It blocks your villi. You got it? So you're not assimilating the proper nutrients, but that seems like what it would be. Because now he's filtering that. He's filtering you. Well, you are filtering it out for him, but he's catching that, and that's what's causing a reaction to the lymphatic system. Yeah, I would pull that off and pull him back off that and see what happens. But also, I would add in the same breath, add that neem oil.
Neem oil. I have one more question.
Sure.
He's teething, right? Would you suggest anything for me to give him with his gums and or anything, or just?
Sure. And how old now? How many months now?
He's 7 months. He's about to be 8 months on the 12th.
Okay. There are some things that you can give babies. Usually when you're teething like that, you got to give him something like, that what did I show y'all? That natural toothbrush.
Oh, yes.
Natural toothbrush.
Yeah.
Remember?
It looked like sticks.
Yeah.
I didn't say that.
Yes, you did. Yes, you did. Yes,
Mizwak.
It's Mizwak, right?
Yeah, Mizwak, right.
You may want to give him a Mizwak stick because he can just chew on that. Got it? And that's what they usually would give babies. They give it to them and they just chew on it. Right?
How you spell that, Dr. Paul?
Miswak.
Right.
Mizwak. And that's actually the first toothbrush, y'all, by the way.
Yeah.
And it'll give him the ability because remember, the Mizwak tree also can be when he's actually chewing on that, he's getting a little bit of the tree too. So that's helping him. That helps.
Thank you. Thank you so much. I hope everyone have a wonderful night. Thank you, Dr.
All
Paul.
right. Thank you.
You got it. All right. Thanks for coming.
They have a Mizwak toothpaste too.
Yes. Yes. But he's too young for that. Yeah, he's just teething. He needs to teeth. He needs to bite down on something. All right, good stuff. Good stuff.
All
though.
right, all right.
Good stuff. Good stuff.
All right, all right. Next to that is Jackie. Jackie, you there?
Yes.
All right.
What
Go
can
right
you
ahead.
do for asbestos? If you've been exposed to asbestos, like the dust real bad, is there anything that really gets rid of asbestos exposure?
Yeah, you definitely have to do a lung detox. Okay, that would be herbs specifically for the lungs. Okay, that
So
means
what is
blood.
it?
That means blood cleansing also. Got it. So, off the top of my head, I'm going to give you some herbs. All right, not to diagnose, treat, cure, prevent any disease, just food for the soul. What immediately comes to mind in this order? Doesn't mean you got to buy all of them, but just one of them. One would be oregano oil. Got it? Oregano oil. Another one would be mullein. 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 Mullein leaf. Nettle. Stinging nettle.
Okay.
Now this one, matter of fact, this one is I might as well tell you because this is my herb of the day.
Well, okay.
Herb of
Write
the
it
day.
down, y'all. Herb of the day.
And that's called cleavers. Cleavers. And what's really good about cleavers, remember, you're cleaning out asbestos out of the lungs. So whenever something like a toxin or something is invaded your system, the body's going to push it into, your lymphatic system, and it's going to sit dormant, but you need something to grab it to pull it out. So you remember we talked about the long chain and the medium chain triglycerides with things like sea moss, right? Sea moss. So that's good too, sea moss. Okay. But you also need something to sort of drag and to pull this out. So something like cleavers, if you were going out, if you see it on the very small level, it's actually grabs and pulls things. So it's almost like if you're having lymphatic issues, this cleavers goes in and grabs like hooks. It's like hooks when you see them, and it's like gonna hook it and pull it out of you.
Okay.
To pull out these contaminants and asbestos and particulates of fiberglass and all that stuff. All right. And then
is that an oil or a pill?
What's that? The cleavers?
Cleavers?
It's an herb.
An herb.
It's an herb. And you can take it as a tea also. Okay. That really is very effective for women with fibroid, cysts, and tumors. Okay. Fibroid, cysts, tumors, goiters, things that, if you want to just cleanse out the system real good, cleavers. I did a whole show on cleavers.
Now, can I get that?
Remember I did a whole show?
Can I get it from the place up there on Broad Street?
You can get it on Broad Street. You can get it in capsule form and you get it in tea form. Okay. Now, a couple more things I would add. Now, I would say you got to add these to whatever herb you decide to use. Usually you want to take something to increase the oxygen level in the body, and that would be CoQ10. CoQ10. Okay, CoQ10. And to help with that antioxidant level, you want to get with like a glutathione or a vitamin C. Okay, these are all lung stuff that we're talking about right now. This is lungs, cleaning out them lungs. Because remember, what you expose to the lungs gets into the blood. Got it? Remember, anything touches your skin is in there in 28 seconds. When you gets in into your inhaling, it immediately goes right into your bloodstream. Got it? So you got to clear that out. All right.
Okay.
I have a couple more. Is milk of magnesia bad to take? Like, what if you're constipated? I
would use better than milk of magnesia.
So what would I use to go fast? Like, I don't want to wait till the next day.
Go fast? What did you say?
Yeah, I want to go fast. Like, I don't want to wait for the next day or two.
Now here we go.
Big vacuum cleaner, Dr. Paul.
First of all, Jackie, I got a bone to pick with you, as old folks used to say.
A bone and a half.
We gotta stop. Remember, we gotta take your time.
Yes.
Right? Your digestive system. You remember it was a time y'all used to go in people's bathroom and there used to be a magazine in there.
Yeah, amen.
That means people used to take their time, don't rush, because that's going to cause constipation. And then eventually that's going to, you're going to strain, and then that's going to cause hemorrhoids.
Yes.
Yep, that's what causes hemorrhoids. So I would say if there was something that you can take instead of that, I would say something like Senna. Senna tea, like a Senna tea. We say not to diagnose, treat, kill, prevent any disease, just food for the soul. Senna, SENNA.
Okay.
They have these things called glucosides that basically binds to when people are going to the bathroom and they're going within like particulates and small pieces and not, this actually brings things together in one mass. Okay, so that would be Senna tea. Another one would be called slippery elm.
Oh, I heard of that.
Slippery elm. That's another one. All right.
Yeah.
I'm gonna give you one more. Aloe vera gel. Aloe vera gel. Got it?
Yes.
You can also grab some papayas. Papaya seeds. Papaya, like the papaya from the papaya seeds. Very anti-parasitic also.
Right. So
only thing is,
you're saying take the real papaya, or I can go buy papaya seeds in the pill?
No, you buy the papaya and then you can just take the seeds. Now, only disclaimer is if you're pregnant or nursing, don't take papaya seeds. Got it?
Okay.
They're toxic to when women are pregnant. Got it? Don't mess with that. Okay.
What about prune juice?
What about enema?
Enemas work. Yep, enemas work. All that stuff works. Prune juice work if you get real prune juice.
You get real prunes, but you gotta find real prunes.
Now, Jackie, I'm gonna give you the 411 right here. All right. Since you want it fast, I'm gonna tell you gonna have to put your sneaks on this one.
Go to India.
No. You can do if you are caught in emergency and you have to alleviate your bowels and you just won't go, then you can grab a little magnesium. Okay. And the magnesium would be Epsom salts, but it has to be the Epsom salts that's digestible. Epsom salts. Not the ones that they'll say do not ingest. They have ones that you ingest and the ones that you don't. And you would just take about a half a teaspoon and put it in some warm water. Got it? Pour a little bit of water and put your sneaks on and stay close.
Well, I know that's right.
You want it fast.
No, but what is the difference? What is the difference in that milk of magnesia and the Epsom salt?
Because they're trying to use the milk, and you got to be careful with anything that's milk of magnesia. It's the other ingredients that are in there. You want to be as basic and raw as possible. Got it? So you're not getting a lot of chemicals and things that are added that, these companies have actually altered these formulas from what they originally were for a long time. Got it? So, it's not saying they don't work for some people, but you want the best results, you stay natural. You got it?
Okay.
Okay.
Epsom salt that you can take internally.
Yeah, Epsom salts that you can take internally. Like grandma used to say, man, I remember one time I couldn't go and little Paul couldn't go.
Well,
man,
I know that's right. I know that's right. All right.
And then, I was saying, I was laughing because y'all know what I'm talking about, right? You think that you gotta pass wind and it ain't wind.
Well, have mercy, down the leg, down the roll.
Wow.
Yes.
Y'all know what I'm talking about, right?
Yes, we does, unfortunately. They call rock and roll.
Yep. Change your underwear. That's
Yes,
what
sir.
it
Yes,
means.
sir.
Yep.
Yes, sir.
Yeah.
All right.
Dr.
Dr.
Paul.
Paul.
Yes.
Dr. Paul, quickly. Can I say
Yes.
something real quick?
Okay.
Hey, Dr. Paul, I just wanted to apologize to Big Bill Morgan, man, because when I first came on, I didn't say hello to you. So I just want to say hello to you. I don't want to come on and not recognize you.
That's all right, my friend. Everything is good.
That's
All's
all.
good.
That's all I wanted.
All right, buddy. Not a
Okay,
problem. Not a
buddy.
problem.
All right. Thank you. All right.
Dr. Paul, I've
Yeah,
got a comment here that I think is kind of serious and we need to take a look at. As a comment there, we have a young lady who has a child. And because of some pressures from our society, she had to vaxed her child. And now she wants to figure out what do I do? Because, she's breastfeeding and he's like, the child's about a month old. What can I do now to cleanse that child?
Yeah, I would have to do a sit down with her and go over that. I would just, go to the website, get the information, the www.vaclib.org.
Right.
I would start there, get some information, get some understanding first.
You're right.
But I would say have her give me a call, because that's not a phone call. That's that we can go over tonight. That's too much involved there.
Right.
We got to really get into it, and I need to help her out with that. But so give me a call. What's her name?
That's
Michelle's story.
Yeah, Michelle. Right.
Michelle.
Yeah, but I think she's talking about regular baby vaccines, not like a COVID. She's talking about regular baby vaccine.
That's what I'm
Same
talking
thing.
about too.
Yeah.
I'm talking about
Okay.
too. Yep.
Yeah.
So definitely I would say just give me a call and we'll go over that, because you got to walk them through it step by step.
Right.
And you have to build up your understanding of where you are, but also I got questions for her. so that would have to be a probe and an assessment call or conversation. Phone call is good. Just a phone consultation is all she needs.
Okay, Prophet, would you put in Dr. Paul's number in this so she make sure she gets it?
Yeah,
And,
just don't set up a phone consultation.
All right, great. Okay.
But in the meantime, check out that website. That's for everybody. VACLIB.org. Go to that website.
Right.
If you want to find out all the stuff, talking points, get all the details on what's going on, that'll give you some insight. All right.
All right. Someone started to say, who was that?
VAC, Sheila.
V as in Victor, AC.
Oh, okay. That's Sheila.
V as in Victor, AC. L as in Larry, I, B as in boy, .org.
Right.
Thank you.
All right.
All right. Okay.
Okay. Let's see. We've done the task and Calvin. Yvette. Calvin, you done, right?
No, we didn't get Calvin, did we?
Oh, I'm sorry about that. Calvin?
Hey, Dr. Paul.
What's up, Calvin?
Hey, how you doing?
What's going on, brother?
I came to see you about a week ago, and I was with your assistant, Andre Capers. We got to talking about the sesame seed oil, and it said, I was like wondering, is the sesame seed oil compromised? The unrefined sesame seed oil, has that been compromised?
Has it been compromised? The unrefined? It shouldn't have been. Not if it's unrefined.
Yeah.
Only if it's been refined. There's only been altered if it's been refined.
Right.
Okay.
Yeah,
'cause
refined
I
is what you look at. Yeah.
I do the oil pulling every day, and I was wondering, at the
the unrefined. Yeah, the unrefined is good. A good sesame oil that's is by a company called Spectrum.
Okay.
That's a good one. Is that the one you have?
No, I get the one at Sprouts, which is pretty good,
Yeah, any of them are good. Just make sure they're unrefined. And remember, family, y'all know what refined versus unrefined looks like. The refined is always going to be a lot lighter oil. It's going to be a lighter oil. Always the dark oils or the unrefined.
Yeah.
Got it?
Also, when I came, when I talked to him, and he was saying to take the CoQ10, the PQQ, and so I got some of that, but it's like only 100 milligrams, and he told me to had to do 1,000 milligrams.
Yeah, you need more CoQ10 to be
pills?
to be effective with CoQ10. You need a high number, close to 1,000 milligrams to be effective, especially if you're dealing with. But it's good to start off with maybe 300 milligrams and just do it twice a day to start off with. That's usually recommended when you look at the recommendation on the bottles, but you need a little bit more than that because you're way too low, way too low. So
Right.
you can get CoQ10 from just normal food and vegetables, but you
Mhm.
need it at a high rate. CoQ10 is the coenzyme, so it helps to keep the heart rhythmic issue of the heart. It's highest in the heart and also your brain. Got it? So
Right.
it increases oxygen flow in the body to receive oxygen into the cell. That's what keeps the heart going. Boom, 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 boom.
Mhm, mhm,
You know,
mhm.
that's what keeps the heart. When they wanted to find out what makes the heart just go to do, do.
Hey, okay,
You
okay.
know, maybe the heart just said, you know, that was my last one, Big B. I don't want to do no more.
I'll do this no more. I'm out.
Boom, boom. That's what it makes. It was the CoQ10. It's like a spark plug to a car. You got it? So when you take that, you need it at a high rate that you can actually absorb. It's all food. It's all food. So, you know, we say not to diagnose, treat, cure, prevent disease, just food for the soul. Got it? So that with the PQQ, and it's not PPQ, y'all. It's PQQ.
QQ.
Yeah, QQ, quarter. Got it? And that's PQQ is the quinine, and that's what deals with ischemic issues. You know, when we look at what's called mitochondrial genesis regeneration with your cells, that's PQQ. That's for people who are dealing with stroke issues, people who are bouncing back to make sure you prevent them, and also to dilate any ischemic issues. Like people have transient ischemic attack, TIAs, or something like ischemic stroke or a hemorrhagic stroke. A hemorrhagic stroke. You don't want the hemorrhagic. That's the vessels. So all of this starts to regenerate cells. Matter of fact, they were given PQQ in some studies and showed that people, when they took PQQ with something like a vitamin C,
Yes.
people started regenerating from things from stroke and started getting activity in the limbs that they had lost flexibility in, or paralysis in areas like that. So it regenerates cells. Right?
So it's
All
Be
good
sure
stuff.
and
All
guys,
good stuff. Make sure
mute
you
yourself. Thanks, Jackie.
Mute yourself. I got her.
Okay.
All right. So Calvin, there you go, buddy. So get you a higher one. Okay. Go to the
Okay.
herbal stores that we recommend.
Yeah,
And
I got the Doctor's Best.
okay.
Okay.
Doctor's best.
Number
Just got to get a higher one. That's all.
I'm sorry.
You got to get a
Okay.
higher one, okay?
Right.
But I mean,
Okay,
it
thanks a
doesn't
lot.
mean you can't. Doesn't mean you got to throw that away now. It just means that you just got to take more of them. If it's
Right.
100, if it's 100 milligrams, then you just got to take a little higher. You got
Yeah.
to take more of them to get to the milligram that we're talking about.
Right.
Okay, all right, thanks a lot.
All
All right, buddy. You got it. You
Is
got it.
that PQQ? Is that PQQ different from CoQ10?
Yes, it's totally different.
Oh,
It's two products all together. Yeah, one is a quinine and the other one is a coenzyme. But you can buy it together. Some of them will be CoQ10 plus PQQ. Or you can actually buy it separate, where PQQ usually starts around 20 milligrams if you buy it separate. That's usually like a general range. It's like usually around that, somewhere around there. Okay.
All right. All right, Yvette, you're up next. Yvette?
I guess, I'm sorry.
There we are. There you are.
Big Bill, Dr. Paul, hi.
Hey, Yvette.
Hi, how are you? Thank you. I, for the past 10 years, have tried this, actually, it might be more than 10 years. The medical doctors recommended this deodorant. It's prescribed. It's called Drysol. and
Okay.
it's supposed to control excessive sweating because nothing else worked. However, when I used it, it was like lighting a match on my skin because the skin under the arms are very delicate and it used to burn. And so I looked at the ingredients and it said aluminum chloride.
Oh, gosh. Yeah. No.
Extra hydrate 20% W/V. I don't know what that means.
That's why it was burning. So what happened? You got maximum, that's a maximum strength right there. Does it say
Yes.
maximum strength on there somewhere?
It says extra strength.
Yeah, extra strength. That's maximum. You can't have any aluminum and putting it in your armpit. You're going to block your lymphatic system, and now it's going to back up in your chest area, in your breast area.
Oh, yes.
You got me? You don't want to block out your lymphatic system. You got to address the problem. See, that's like putting a Band-Aid over a bullet hole. They're going to give you something to stop you from perspiring, an anti-perspire. When your body's saying, no, I need to detox. I need to get something out. So it sounds like, just in general, not speaking your situation, but based on what you just said, that means you need a detox of the lymphatic system. You got it? If you're having excessive sweating, that means that you got to get something out of the lymphatic system. You're still triggering something that's throwing you off, that you got to get it out. And now this is what happens. Remember, the lymphatic system is the sewer system of your body, right? That's the secondary circulatory system, not like the first system, which has a pump. This one doesn't have a pump. So that means you could have blockage in any area of the lymphatic system. Now, do you have any swelling around the neck area, under the armpits, or in the groin at all?
No, but I noticed when I was using it, because I don't use dry sol anymore. I've been trying different products without the aluminum. And I came across something that actually does work. But I noticed when I was using the dry sol, the chest area was sweaty, but I don't have that problem anymore since I've switched my deodorant. And then the doctor also recommended, they said, well, if the dry sol isn't really working, then we can give you something with formaldehyde. I'm like, that's dead people's fluid.
Oh, gosh. Yeah. You see,
so I refuse that. I refuse to use that.
Oh, gosh.
Thank you, Lord.
Why don't they just put some plaster under there? Why don't you just throw some plaster?
We just embalm her. How about that?
Yes, yeah. So I refuse.
Oh my gosh, this is crazy. Listen, this is what you got to do. All right, you got to tackle the lymphatic system. So you want to look into, and I don't know exactly. Of course, you would have to come in for an assessment for me to be on point with you. But just in general, from what you're saying, lymphatic system is overreacting. So that means that something is triggering that. Could be food choices. It could be something that's could be what's called lymphatitis, which is actually some kind of infection in the lymphatic system. Something is purging. It's got to purge. Whenever there's a purge going on, is something saying it's got to go. Your body has determined we're not even going to have this for discussion. You got to go. So it's trying to get rid of it. So you have to look at things like Mary Ruth formula. Mary Ruth. Mary Ruth lymphatic support.
How do you spell that?
Mary.
Yes.
RUTH.
Oh, okay.
Ruth lymphatic support. It's a liquid that is used for flushing out the system. And like I also said earlier, one other one would be good for lymphatic system would be cleavers. Cleavers.
Yeah,
Cleavers. That could be a tea or capsule. Also, Pal d'Arco. Pal d'Arco. That's PAUD'Arco. And if I were to give you one more, I would do something like a red clover. Or a horsetail, red clover or horsetail. Now, this does not mean you got to go and get all of these. Just work with one of them as a tea. But that lymphatic support will have a combination of them in there. Now, how's your exercise?
I need to improve. I do 10 minutes at least every morning, the same time on a Peloton bike, 10 minutes.
Yeah, try to do a little bit more of that.
And then, I walk around a lot because my job requires me to be on my feet. So I'm up and down the steps. I'm all over the place. So I do a lot of walking.
Yeah, but we need control.
Consistency.
Consistency, same time. So just increase the time frame. If you're already doing it every day at the same time, just increase the time. Then instead of 10 minutes, Get yourself a good 20 minutes. 20 to 30 minutes would be even better.
To break a sweat.
Mhm.
Yeah. That's
Yeah.
what you're trying to do.
You got to
See,
do that.
if you're sweating profusely and they're trying to deal with excessive sweating, then that means that that's the crisis point that the body has reached. You
Right.
have to voluntarily move this stuff. Remember, the lymphatic system, not like the first system, doesn't have a pump. It only has those muscles that twitch, but they only move when you move. So that means a person who exercises every single day, I mean, that's the fanatic that works out every day. The lymphatic system only moves one time.
That's deep.
You got it? That's just one
deep.
time. You got
Yep.
it? So you can imagine that there could be some backup if you're only doing about 10 minutes and you're not sweating. You got it? So you got to get intense with it a little bit.
So I tried, and I'm gonna work on that because I'm gonna work on trying to do more dancing and, like African dancing and ballet and all that.
But I would do something more. I would be more precise with your time. See, when you don't do something that you will require you having to go somewhere, do something, do it same time. If you're 8 o'clock, 9 o'clock, 10 o'clock, just get it in. And then therefore you can start to, move that. Now, what also, last thing, what can also help you would be a infrared sauna, far infrared sauna would help you also.
Where would I find that?
Dr. Ethel Wilson has one. Prophetess, I know you already got it in there. She probably already got the number in there.
I'm getting it.
Okay. Okay. I'm just checking. Usually I don't even have to do this. I'm like, oh wait, already there. Yeah. So what we're looking at is Dr. Ethel Wilson, and she has a detox center right on Broad Street. Right off of Broad Street, not on Broad Street. I'm sorry, off Broad Street. Not too far from Broad and Erie area. And she will do foot detox. She also does the far infrared sauna. She does colonics. I would definitely recommend you all check her out. Enjoy yourself and have a pamper day for you. Got it? Let's see. You got it there, Prophetess?
Yes. I just have her phone number. I don't have an address. I'll get it.
Yeah, the phone number is there.
Yeah, I don't have. This the 610-585-0493.
93. That's correct. That's correct.
Yeah.
And while you guys are kind of a little bit of a hold, let me remind everybody, guys. Prophet has worked real hard. All that information that Dr. Paul's been talking about down there is in the chat. You want to make sure that you request this chat at the end of the program tonight, right? And you send that information to meccavideo@gmail.com. meccavideo@gmail.com to request a copy of tonight's chat. We'll talk about the other stuff at the end, but I just want to get that in while we're talking about it.
Yes,
sure, man,
Big
no
B.
problem.
Absolutely. Thank you. And also support the family tree, y'all.
Yes.
Big B over there is really holding it down. We are streaming live on maybe y'all want to drop something on. I got some comments over here on I see some comments on the other side where we're looking on the that must have been
on YouTube
that must be my son over there. I think that's him. But anyway, we're on YouTube today. We're on YouTube this evening. So if you are chiming in, you want to get somebody, we are live on YouTube right now, also streaming. All right. So let's see. Who do we have there, Big B?
Okay, guys, we
got about 10 minutes.
Yeah, we got about 10 minutes. We got Haraya. We got Haraya, Laverne, and Vanessa. That's it. Haraya, you there?
Please. I'm here.
Go ahead.
Hey, good evening, family. Before I get to my question, and I'll be very quick, Dr. Paul.
No quick, just important. No quick.
Okay.
No quick, important, right? That's
okay.
Go ahead.
Right. My ninth child, my son, he had eczema all over his body. What do you think about not internally taking the oatmeal, but I used to bathe him with the oatmeal water, just to broth off top of the oatmeal. And we didn't use the oatmeal internally, but I'm glad to know that information, this was some 30 years ago. But anyway, the thing about it, I would bathe him, just have a bowl of the oatmeal water and just take a cloth and be bathing his skin all over. the oatmeal water would dry skin out because it has like a coating to it. So I would rub them down then with the olive oil or the shea butter or whatever. But I found, so I just wanted to say that gave a lot of relief and cleared up the eczema. But I found that every time I ingested caffeine, anything like at that time, 30 years ago, I might have drank a soda or something. I would drink coffee and caffeine. So you have to be very careful, even a chocolate or whatever, anything that has caffeine in it will activate the eczema. So I just wanted to let the sister know that, to check her foods for anything that has caffeine in it.
She's pretty tight on that part, because she does a holistic diet. She's definitely on that holistic side. But I wanted to address the oatmeal. Okay, oatmeal, that's the reason why you didn't hear me say oatmeal baths, because of what they're spraying with the oatmeal. Remember, I just said that with the spraying. Normally, yes, that would be a comfort for a lot of things like eczema, psoriasis, rashes, even someone who had, the herpes virus outbreaks. Yes. All of that would usually be very well needed with an oatmeal bath. That's usually what we would usually recommend. But because of what they're dealing with this oatmeal right now, I don't trust none of it.
I know, that's right.
I would hate to be exposing anybody, including a baby, to the pesticide chemicals of spraying and just not know any better.
Yes.
So that's why we got to be really on point, y'all. We got to be right on point. And that means oats of all kinds. Yeah.
Okay.
All right. Good stuff, though.
Don't take my time up now. Wait a minute.
Go ahead.
Go ahead, Harai.
I just wanted to say, with the teething, I would take my finger and massage the gums with a little nutmeg and cloves. I had a mixture. I forget. This was like over 30 years ago, so I forget what the mixture was, because I'm scared, Dr. Paul, with the miswak with the baby. I would use one of those fat carrots, and I cut it, slice it down the middle, and put little grooves on the side so the baby's hand could hold it. It wouldn't have the opportunity to slip back and forth and jam in the mouth, because they still are working with their muscle control. I'm just sharing this. I don't want to.
Yeah, you would never, with a baby that young, you would never leave them unattended or give it to them by themselves. That's what I'm saying. So you would never do that. So when you're talking about the Mizwak, that would be a safer piece than a small carrot or something getting caught in the throat.
No, I use the fat ones. The big fat
so that's still, I wouldn't even use the carrots. I would use the Mizwak. You would just have the baby while she has the baby's going to be gnawing on it. So you're never going to let the baby take it by themselves. Right. So they would not be able to choke themselves. Got it? Okay. So that's the key. Yep.
Okay.
So all good stuff.
Question.
And we got to get ready to go, Ryan. Okay.
Okay. So I went to the doctor this week, and then 2 weeks ago I went to another doctor. Both of them, my blood pressure was 140 over whatever the number is supposed to be, and then this week it was 146. Does that send any red flags to you? Because both of them were saying it's not like alarming, but it's elevated. So and you're a line of thinking. How do you feel about that?
I think you need an assessment. That's what I think. You would come on in and be sure. Don't guess.
Yes.
You're guessing. You're guessing. They're guessing. And don't guess. We got to know. Remember, I just went over the 3 methods of what causes blood pressure issues. You got to find out what's your problem.
Yes. Everybody's different. All right.
Is your vessels moving or not moving? Is it plaque buildup? Is it something that's going on with the back of your spine? Are there other things that are going with the autonomic system? That's what the ARM3A is all about. So don't guess. Be sure. Okay.
Okay.
So come on in, get an assessment, and we'll move from there. We'll go from there. Okay. All right.
You got it. Very good. All right, Laverne, you're next.
Yes, sir. Good evening to you and the crowd. When you include oatmeal, does that mean Cheerios? Because it says 100% whole grain oats, non-GMO.
And look on the back, it says bioengineered products. You shouldn't be eating on any of that.
I don't see that on here.
It's there. Yes. Go all the way down.
Go all the way down. It's there.
But I like the Cheerios in the morning.
It's not on Cheerios. It's not on the Cheerios box.
Hold on. Wait a
It is on the box.
Sorry.
I read it last
Hey,
week.
Laverne, we're live now. Come on now. Hold on.
On the
I want you to go down in your ingredients, turn it to the side.
Right? It's on the box.
Got it? You got your glasses on, right?
Got my
All
glasses.
right, go all the way down to the
Trace.
bottom. Go all the way to the very bottom. Do you see anything that says made with bioengineered ingredients?
No, sir. I don't see that at all.
Okay.
There you
So hopefully it's there. I don't have Cheerios, so I don't know.
Okay, I'll look for it. But anyway, I just want to say for those who get tired of drinking water all the time, ShopRite sells this Mojo organic coconut water.
Mm-hmm. Yeah.
Mhm.
And it tastes good, non-GMO.
Mm-hmm.
And it's got electrolytes in it, and it makes you feel good and relaxed.
Laverne, I think you found your mojo.
Looks that sounds like it, doesn't
And it does.
Yes, I think you found it. Yes.
Yes,
I
yes,
think
yes.
it's good. Sounds good to me.
All right,
What
all
about
right,
you,
all right.
Big B? Sounds
Yes,
good
sir,
to you
bud.
too?
Yes,
All
sir.
right.
Sounds good to me. All right, Laverne, thanks so much. Let's get Vanessa in here now, and so because we are out.
Vanessa, you're pulling
Vanessa,
up
you
the
there?
anchor.
You pulling up?
Prophet is about to rob. He about to pull the plug out on us.
I'm here.
All
Hi,
right.
guys.
Go ahead, dear.
Okay, here's my question. The last couple of shows I've been able to watch the next day on Facebook. I couldn't find you last week the next day. How do I find you on Facebook? Not YouTube. I want to watch you on Facebook.
Oh, it's there. Oh,
It's
you know what?
there.
Listen. You can go. You can also go to my Facebook page as well as Dr. Paul's. All right. But you go to my Facebook page, and it's everything is there. It's on the videos.
You know what I'm gonna do? I'm gonna do this. If you're listening and you want to be a part of this, I'm gonna drop the link to the link where we have the Holistic Health Network. Okay, I'm
Right,
gonna put that there. If you are already someone that's on Facebook, all you got to do is click on this, and your account should go through. If
Yes.
you don't have a Facebook, this link is not going to work for you. Got
Okay,
it? So
okay.
I'm gonna put this in here. Let's see. Share. Where am I? Chat. Here we are.
Yeah.
Chat. I'm gonna put this in here for everybody. This is the link to the Holistic Health Network. Subscribe to, send me an invitation and we let you in. This is the private group right there. The private group, if you're listening by phone, is www.facebook.com/groups with an S.
Yes.
/Dr. Paul Holistic Health Network. That's the name
Right.
of it. If
Yep.
you're searching, maybe you want to go to Facebook. All you got to do is punch in Facebook, Dr. Paul Holistic Health Network. All right. And then you'll get all the shows from last. Big B over there is posting them, and you'll get
Yep.
all the shows from WURD.
Yep.
We'll get all of them. You get everything in one location.
Yep.
Okay?
That's all.
So I like to hear myself the next day, like things I've asked you. Also,
Well, yeah, it's always good to do that because it also brings stuff back to you, Vanessa, that you don't remember
Yeah,
when you're
absolutely.
doing it.
Exactly.
And when you've got the chat in your hand, it also makes it better because it brings things back to you.
Absolutely.
All
Okay,
right.
Last question.
Okay.
What are the signs that our liver detox is actually coming to completion?
Okay, who is that? Say that again now. What
That's
was
Quincy.
That's Quincy.
What
What's
are the
up?
signs that let you know a liver detox?
It's coming to an end.
It's coming to an end, you mean?
Yes.
Well, when you're doing a liver detox, first of all, we're trying to do 3 to 6 months. Got it? I try to do 3 to 6 months because if
Okay,
people are trying to
okay.
do something, you do something. But I mean, it doesn't take that long. Absolutely not. You
Right.
just want to make sure that you're cleansing, keeping your water cleansed. You just keep on going. We do a test, a urine analysis test, which looks for bilirubin. And usually from those levels, we can tell if it's cleaning and it's clearing out, things like that. Usually you start to see clarity with the skin, eyes clear up, no issues with yellowing of the eyes, things like that, skin. If there's bumps, blisters, boils, psoriasis, you clear them out. So you try to get at least 3 to 6 in. That's what we try to do.
Thank you.
All right.
Okay, guys, thank you so much.
Thank you.
All right,
Appreciate
very
you.
good, very
Appreciate
good. All right, Dr. Paul, let me just get this in before we go anywhere else. And that is, guys, we're at that point. And we get the bounce, y'all, to make sure you get a copy of tonight's chat.
We got the bounce because
Send an email to
we got to get out.
That's right. MeccaVideo@gmail.com. To support the family tree, guys, use my Cash App. That's $Bill Morgan. That's $Bill Morgan. And to use Zelle, that ID is Dr. Paul at drpaulherbs.com. Or use our P.O. Box, which is at the P.O. Box 191 Mullica Hill, New Jersey, 08062. Guys, bring your friends, bring your enemies, bring your frenemies, bring everybody right here to the tree every Wednesday night so we can be with the tree. Love you guys. See ya on the weekend. God bless.
All right, y'all. I want to thank
Yes, sir. Yes, sir. Yes, sir.
to the family tree. Put your hands together. Did you learn anything this evening?
Yeah, buddy. Yes, sir. Yes, sir, buddy.
A lot. Yes, I did. What's up, Friday? Friday, what's up, Doug?
God bless you, baby.
Hey, you
Yeah, buddy.
anchor, man. I didn't even see you in there.
Yeah.
We're going to close out, y'all, but I want to thank you all for chiming in. The only thing we charge you with is the truth, that you go share this information, give it to somebody.
Yes.
Share the information so that you can apply the principle. Got it?
Yes.
Don't
It's
sit
all
on the
counts.
information, go share it. That's how it comes back to you, and you get blessed even more. How about that? So I want to thank you, be encouraged, and remember, if you breathe,
Yeah, gun a shot. Yeah. Prophetess, fingers, and the Mickey.
I want to thank you.
Appreciate you. Love you, Prophetess. Yes. That's what's up. Yeah.
Thank you, Prophetess.
Yeah.
There you go. Think about it. And we're going to say a big B over there.
Yo, buddy. Yeah, buddy. Yeah.
Thank you, buddy. I appreciate you, man.
Always, man.
And
Always.
also, family, support the family tree so we can keep this thing going. And also,
Yes.
those family tree and the Facebook and all those things. And go share it. Send it around to family and friends. They need to hear this information. Got it? All right, we're going to dance it out because Marcy's looking at me like I better do this or else I'm going to throw something at me.
I know that's right. Yeah.
Good.
Yeah.
Come on down.
Yeah.
That's the perfect music. Oh, I like that groove.
Yeah.
Man.
That's really nice groove.
Come on down.
Yeah.
Oh, that's how you get that clean looking skin.
Yeah.
People say, what you doing, girl?
What you doing?
You say nothing. I ain't doing nothing.
I ain't doing nothing.
Come on down. Tap. That's right. Tap it out.
Tap. What's up, Free? Let's move. Well, get it, Free.
Go ahead, Frida. I see you, Frida. All right. Come on back here in the side, right behind the breastplate.
Yeah. Tap.
Come on down. Left and right.
Yeah.
Left side.
That's on the left side. Yeah.
What's on the left side?
To the right side.
That's right.
All right, big wave. See you, buddy.
Right side.
The liver.
Right side.
Yeah.
The gallbladder and the liver.
Yeah, Cecilia Jones. I see you.
I got a new one for you. Take your fist like this. Take your fist, and I want you to press it right on your back. And I want you to rub it like this. Rub it right.
Do that. It feels so good.
Good. That's one of those games that good. Googa mooga. What is happening there, man?
That's one of the kidneys, right?
In circles.
Yeah. Indeed. Yeah.
See, after you've been sitting for a while, that's perfect.
Yeah, but
kidneys, right?
yeah, man.
Good and breathe.
I have to do a lot, man, at school every day because I'm sitting all day long.
Right. And I got another one for you.
What you got?
Take your thumbs. Take your thumbs. And I see one G right here. Let me take the glasses off. Right here, in the inside of your eyebrows. I want you to take it right here. It almost feels like your thumbs belong there, don't it? Don't it feel like that? I want you to raise your hands up like this and press. And press. And press. This relieves migraine headaches, right?
Oh, look at now.
Press. And press.
All right now.
Release. Good.
This
See
acupressure,
there?
Dr. Paul?
Yeah, besides you looking like an elk, this actually helps to relieve.
From the Star Trek movie.
Yeah, buddy.
Breathe. And breathe. Good. And release. Head out.
Yeah.
Head out.
Yeah.
Breathe in. Breathe out. Breathe in. Breathe out. Breathe in. Breathe out. Good. Breathe in. Breathe out. Y'all right to the beat. Breathe in. Breathe out. I see you, Marcy. Breathe in.
Yeah. All right, Rosetta. Keep it going. Yeah. All right, Marcy.
Breathe out. Last one, I want you to hold your hands together like this.
Yeah.
Turn it the other way like that.
Yeah. Yeah.
Push it. And push.
Oh, yeah.
And the last thing I'm just gonna have you do is just spread. On over.
Yeah.
On over. And back on over to the other side.
Yeah. There you go, family.
You're loosening up now. It's the post stretch after all this sitting and getting all this. Alright.
Yeah.
Wrap it up.
Yeah.
Wrap it up. Come on, put that energy going. Wrap it up. And stop and throw it on down.
Yeah. Give us that good band. Yeah.
All right. One more time.
Yeah. Hey. Yeah.
Bless yourself. May God bless y'all. May God keep y'all. And remember, thank you for joining in on
Family Tree.
on the weekend.
You got it.
Look at this. I see you real quick.
Yeah, get it, Brenda. Get it, breathe out. Move, Cecilia. All right, Haraya, move it. Yeah. All right.
Go ahead, Bianca. What's up, Brenda? Brenda
Brenda's a mess with me. I got this going on, boy.
You ain't playing either.
Brenda's actually playing. I got this.
Brenda, go ahead,
To the right. To the left. To the right. To the left. Yeah. All right, get it, Claudette. Yeah. Get it, Bianca. Hey. Yeah, buddy. 9. Yeah. 8. 7. 6. All right now. 5. 4. 3. 2. 1. Good night, everybody.
My family.